Last year in South Carolina, 4 firefighters died in the line of duty, but that's not how most of them die. The #1 killer of firefighters is actually cancer.
Now, there are many firefighters in the Midlands who have had or are currently fighting cancer, but this battle may not be considered in the line of duty. News 19's Mary Sturgill looked into how advocates are helping firefighters understand the dangers.
I kind of figured what's going to happen is going to happen, and I'm going to do everything I can until the inevitable.
Bucky Mock is talking about his multiple myeloma cancer diagnosis in 2012. Since then, he's gone through numerous rounds of chemotherapy and a bone marrow transplant. But there is no cure.
And there was a tag included in the gear, and on that tag, they said, cancer is a leading cause of death in firefighters. And multiple myeloma is one of the leading firefighter cancers.
Mock has been a firefighter for more than 20 years.
And all of a sudden, it dawned on me that my cancer came from firefighting. There was a good possibility, and it hurt.
Cindy Ells with the International Firefighters Cancer Foundation travels the country educating firefighters and others on what research shows about a connection between fighting fires and cancer. At the Firefighters Conference in Columbia, she shared statistics.
Yes, gentlemen, you're looking at a very high rate of testicular cancer. Multiple myeloma, the other blood cancers, were some of the first ones that we actually could attribute to a benzene exposure.
According to research she cites in her presentations, firefighters are more than 100 times more likely to get those cancers than the general population.
That's what makes firefighting so unique. You're getting a stacking effect of many chemicals and specific chemicals that weren't designed to go together. So the body and the body's immune system is not designed to fight these, and hence we have a huge growing cancer effort.
But something that hinders that effort is the lack of statistics.
How many of you have had people in your department who have had or have cancer?
Despite the number of people who raised their hands at the conference, there is no data for South Carolina. Carter Jones with the Firefighters Association explains.
And we're trying to educate firefighters when you go to the doctor, not only list your profession as a truck driver or whomever, but also list that you are a firefighter so that we can begin capturing this type of data.
So News 19 attempted to collect some data of our own. We reached out to all 93 fire departments in the Midlands, asking them to self-report the number of firefighters they had who had been diagnosed with cancer. 20 of them responded. 2 departments refused to participate in the study, citing either HIPAA violations or saying there is no connection between fighting fires and cancer. Now, of those reporting, at least 2 areas stood out. One fire department in Orangeburg County had 4 firefighters battling cancer. And in Kershaw County, 5 recent cases of firefighters with cancer, 4 of them colon cancer. Joel Mills is one of those. He was diagnosed in 2014. He doesn't know if his 20-plus years fighting fires has anything to do with his cancer, but he says there is no history of it in his family, and he's lived a healthy lifestyle.
Well, I was surprised that I had cancer because I didn't feel like I did anything that was could cause cancer. So, I mean, I don't know what caused it, and nobody can tell what caused it.
Mock and others are trying to spread the word on the importance of early detection. Mutt Bozard has been a volunteer firefighter for 20 years in Clarendon County.
The first year we had physicals, we found 4 folks with cancer. I was one of them.
Progress in research is being made.
It's becoming technical to the point where we are literally connecting the cancer to the toxin or carcinogen to the body organ. And it's taken the medical technology of the equipment itself to catch up.
But making the specific connection in firefighters is still difficult because of other environmental factors. Dr. Scott Summers is an oncologist.
There's clear research, really now spanning decades, that firefighters are at an increased risk. A 5% increased risk is not a tremendous increased risk over the standard population when you calculate cancer risk for everyone, but it is clearly increased.
I've been fighting fire for 20 years and you develop one of these types of cancer. It's hard to say. You know, fighting fires cause the cancer. So it is a major, major problem.
We now know some things firefighters did or didn't do for many years may be contributors.
Fight the fire. If the gear isn't too bad, I put it in the back of my car and I drive around as it's off-gassing carcinogens and I'm breathing it all the time. And then the next fire, I put it back on again. And finally, when it really gets bad, I'd wash it.
Did you used to ride around with your stuff inside your vehicle?
Yes, I did. I mean, in the back seat of the truck, yeah.
In May, I'll have 50 years with the fire service. And for years, it was almost a badge of honor that the dirtier your clothes, the dirtier your helmet, reflected that you were an aggressive firefighter.
Now, Mock and others are being aggressive about teaching firefighter safety when it comes to cancer. Mock travels around the country giving his presentation on the importance of protecting yourself.
I'm trying to get the word out to people that you've got to decon your gear at the scene and then get it washed as soon as possible.
That brings problems because the more you wash your gear, the gear begins to deteriorate. That requires new gear, increased budgets, but health is an issue we cannot ignore any longer, and education is a key.
That education is Mock's mission, hoping to save members of his firefighter family some of what he's gone through.
I could tolerate that I got cancer, but when it came from my passion of firefighting, that was like somebody kicked me.
Mary Sturgill, News 19, WLTX.
Well, to learn more about the research and what information is available to you, just go to our website. We have our data and helpful links with this story.
Almost exactly 1 month now after we shared with you our investigation into firefighters and the rate at which they get cancer in our story called Cancer, Killing Our Heroes. Since then, News 19's Mary Sturgill reports there is a new initiative in our state to help get the data so badly needed.
Since Bucky Mock's multiple myeloma diagnosis in 2012, he stopped his maintenance chemo last year.
I have wanted to lead as normal and productive life as I can.
That desire motivated the 72-year-old to climb almost 3,000 feet up El Capitan and rappel down. But now he's on another mission.
It was right after the airing of Cancer is Killing Our Heroes, and when you said you contacted 93 stations and only 20 responded, and some said they absolutely could not give you any information, we then decided that the best way to get the information would be to go directly to the firefighters.
So in partnership with the South Carolina Firefighters Association, they have created a database in which firefighters log on and self-report.
It takes a very short time to complete, and it gives us some pertinent information.
Jason Pope with the association couldn't meet us for an interview today, but he sent this statement saying, "The State Firefighters Association is trying to do its part in addressing the emerging issue of firefighter cancer. Is the job killing them? The answer is maybe. The lack of good data within our profession has been a stumbling block for getting presumptive health coverage. So we have created this survey to build our own database."
If we can get a presumptive act, presumptive care means that people that have firefighting related cancer are covered by workman's comp.
But before any of that happens, they need data for our state. So in this new battle, Mock has now added this component to the best practices and cancer prevention talks he gives around the state.
I don't want fellow firefighters to have to go through what I've gone through.
Mary Sturgill, News 19, WLTX.
Well, each firefighter who participates in the database will receive a cancer survivor pin. You can find the link to that Fire Association's database and more on the story, including that first report, at WLTX.com.